Yes.
Okay, great. I think we're going to go ahead and get started since we have a full agenda. So before I hand things over to the mayor, I'm just going to quickly run through the speaker order and the order of events for everybody's information. So first, Mayor Levine Cava will deliver her remarks in English and in Spanish, and then we'll have Acting Chairwoman Rebecca Sosa speak, followed by Dr. Peter Page, our new Chief Medical Officer, Carlos Magoya, President and CEO of Jackson Health, City of Pinecrest Mayor and League of Cities Vice President Joe Corradino, City of Miami Mayor Francis Suarez, City of Miami Beach Mayor Dan Gelber, City of Hialeah Mayor Carlos Hernandez, Michael Finney, the Beacon Council President and CEO. And then we'll go ahead and take questions from media in English and Spanish. When we get to the questions, please feel free to just put up your hand in Zoom and we'll unmute you and we'll work to get to as many questions as we can. And then we'll have our Haitian Creole translator provide the translation at the end for the full remarks. So with no further ado, because we do have a pretty full program, I'm going to go ahead and turn it over to you, Mayor Levine Cava, to start.
Thank you so much, Rachel. And thank you everyone for being on this call, Zoom call, my first press event as your new mayor. Very excited to be with all of you. So I want to start with thanking all of the leaders who are part of today's program and all of them who are joining with a unified voice to help make sure our residents know exactly how critical it is to prevent the spread of coronavirus, and particularly as we head into the holidays. I want to thank those on the call today, our acting chairwoman, Rebecca Sosa, our incoming chair, Pepe Diaz, our county commissioners, and thank you for helping steward our county during this difficult time. To our new Chief Medical Officer, Dr. Peter Page, you'll be hearing from him shortly, and Mr. Carlos Magoya from Jackson, thank you so much. And all of our wonderful city mayors, including those that I see so far, Mayor Suarez, Mayor Gelber, Mayor Hernandez, Mayor Corradino, and all of our city mayors, 34. We love you. Leaders from across our business community, including Michael Finney from Beacon, you'll hear from him shortly, Bill Talbert from Greater Miami Convention and Visitors Bureau. We have Alfred Sanchez of the Greater Miami Chamber, Eric Knowles of the Miami-Dade Chamber, Brittany Basant from Chamber South, Wendy Kalergis of the Miami Hotel and Restaurant Association, Lillian Lopez of the South Florida Hispanic Chamber, Joe Chi from Kamakol, and all the other business leaders that are listening in. It is critical that we work with all of you to keep our economy moving forward. We have higher education representatives, leaders on this call, including President from University of Miami, Julio Frank, our President Hardrick of Florida Memorial, and our new Miami-Dade College President, Madeline Pumarriega. You're all working with us to keep our community safe. We have many medical experts on this call, as well as Dr. Page. We have our Dean, Robert Sackstein from FIU, Dr. Ferreira, Dr. Abo, Dr. Vallarta from Health Department, Dr. Marty, Dr. Trepka, and Dr. Elmir. So thank you so much. And I want to especially thank our new Chief Medical Officer, Peter Page, Dr. Peter Page, who will be speaking briefly. He's stepped up at a time of crisis. He's going to provide a trusted medical voice to all of our community. I am committed to being upfront with our community about the risks and realities of this pandemic. And my number one priority is, as mayor, is to protect the lives and livelihoods of all of our residents. The bottom line is that COVID cases are on the rise again, as you know, in Miami-Dade. That is threatening our health and our well-being, especially our most vulnerable, and putting our healthcare workers and frontline workers at risk, especially. So rising cases also mean that we risk setting our economy backwards after we have worked so hard and together to get the virus under control earlier this year. So first, I want to provide a quick update on our COVID response and recovery. I am extremely proud of our county departments for going above and beyond these last many months. Very agile, extremely diligent, They've done so much to support our community and keep us all safe during this crisis. We have stepped up on testing and tracing and isolation. These are critical components still of our effort to curb the spread of the coronavirus, as they have been since the beginning. We've seen a recent uptick in demand for testing, which is good. We have the capacity to meet this demand. And on Thanksgiving Day, we're going to stay open at our county sites from 7:30 a.m. to 1 p.m. to make sure to meet the demand. On the contact tracing front, we have 250 contact tracing personnel through our own county grant, and a total of 578 personnel working on contact tracing for our county. Over the last 2 weeks, we've seen a doubling in the number of cases they are tracing. So I just want to underscore that's a very important point, a doubling in the number of cases they are tracing. However, 30% of the cases are never traced. So we continue to urge all members of our community, if you are contacted, to take the call. It's one of the most important things that you can do to help us continue to track and prevent the spread of the virus throughout our community. And I also want to encourage all of you to download our app, Combat COVID app, which has seen a recent uptick, especially among younger people, of use of the app. And something you can download easily. It's free. You download it now. You don't wait till you're sick or until someone you know is sick. Once you test positive, you'll be able to update the information. It's free, and it's one of the best gifts you can give your family over the holidays, as our director, Jack Bentalila, has earlier told us today. So we're continuing to provide hotel rooms. That is provided through the State Office of Emergency Management for those who've tested positive and need to safely isolate, both for our first responders and members of the general public. If you need a room, we have capacity. Call 311. We're also continuing to provide our seniors with free meal service, and you can call 311 as well to request meal delivery. 3 domestic violence shelters will continue to operate over the holidays, and the daily dashboard is updated each day here, miamidade.gov/new normal. So let's repeat, miamidade.gov/new normal. I will also be sharing the dashboard daily on my Twitter account, which is at Mayor Daniella. So regarding enforcement, and our wonderful Miami-Dade County Police Department, we need to make sure we are all being vigilant. We need to have uniform enforcement across the board to curb the cases. I'm grateful to the cities that are stepping up, and our county will do the same. Our county communications team has also been working to share important information with how to stay safe, especially over the holidays, because we know it is not the holidays that we're used to. Our digital TV and other communications channels are putting that information out, and many more resources are available on the county website at miamidade.gov/coronavirus. and all of our social media channels. So finally, a quick update from Miami International Airport. Traffic is up, which in many ways is a good thing, shows that people want to come and visit. But as we continue to see the increase, which we expect to see throughout the week, we must continue to be hyper vigilant. MIA is asking all passengers to conform with all the social distancing, masking, and other requirements. And we also ask you to please be careful and get tested before and after you travel. That is good practice. As we head into the holidays with the cases rising, it's extremely important for all of our residents to remain vigilant and continue following public health precautions over the coming holiday. So finding ways to enjoy the holidays while remaining safe is key.
The other one, and I know
we have some background noise there, is key to fighting the spread of coronavirus, to protect ourselves, loved ones, neighbors, and our brave first responders and healthcare workers. Fighting the spread of coronavirus is the only way to protect our businesses and keep our economy moving forward, our lives and our livelihoods. There are a few important guidelines that we can all remember to stay safe throughout the holidays. The best way to curb the spread is to limit gatherings to members of your household, people you regularly associate with, and to limit it to outdoor celebrations wherever possible. And Dr. Page will share some further important health guidance on this call. I know how hard this year has been for all of us. I know that especially after these long, difficult months, it's even more challenging not to enjoy the holiday celebrations we want to enjoy and are so familiar with. I truly believe that hope and solutions are on the horizon. We know the vaccination is coming our way. As a community and as a country, we will be able to defeat this virus. But to continue moving forward, we can't let our guard down. We must work together to keep coronavirus from spreading by taking these small, important actions at home, within our own families, and in the community. So thank you all for joining us once again. God bless our families. Happy Thanksgiving. Y ahora en español. Buenas tardes a todos y gracias por acompañarnos en esta llamada hoy. Agradezco a todos los comisionados, los alcaldes, nuestros líderes de salud de Jackson y los líderes empresariales por ser parte de esta importante conferencia de prensa. Gracias por unirse para ayudar a comunicar claramente a nuestros residentes lo importante que es para todos nosotros prevenir la propagación del coronavirus, especialmente a medida que nos acercamos a las vacaciones. Quiero agradecer especialmente a nuestro nuevo director médico, Dr. Peter Page, de Jackson Health System, por dar un paso adelante en este momento de crisis para brindar una voz médica confiable a nuestra comunidad. Estoy comprometida a ser sincera con nuestra comunidad sobre los riesgos y las realidades de esta pandemia. Mi prioridad número 1 como alcaldesa es proteger las vidas y los medios de subsistencia de nuestros residentes. La conclusión es que los casos de COVID están aumentando nuevamente en Miami-Dade. El aumento de casos significa que corremos el riesgo de hacer retroceder nuestra economía. Después de que trabajamos tan duro para controlar el virus a principios de este año. Por eso es tan importante que todos nuestros residentes permanezcan atentos y sigan tomando las precauciones de salud pública durante las próximas vacaciones. Encontrar formas de disfrutar las vacaciones sin dejar de estar seguro es clave para combatir la propagación del coronavirus. Y luchar contra la propagación del coronavirus es la única forma de proteger nuestros negocios y hacer que nuestra economía siga avanzando. La mejor manera de frenar la propagación del virus es limitar las reuniones a los miembros de su hogar y celebrar al aire libre, si es posible. Y Dr. Page compartirá algunas pautas de salud importantes adicionales en esta llamada. Sé lo difícil que ha sido este año para todos nosotros y sé que especialmente después de estos meses largos y difíciles es aún más difícil no disfrutar de las celebraciones navideñas con las que estamos familiarizados. Sé que hay esperanza y que como comunidad y país finalmente podremos derrotar al virus. Pero para seguir avanzando no podemos bajar la guardia y debemos trabajar juntos para evitar que el coronavirus se propague tomando pequeñas e importantes acciones en casa, dentro de nuestras propias familias. Gracias a todos nuevamente por unirse. Dios bendiga y a nuestras familias y feliz Día de Acción de Gracias. And now to our acting chairwoman, Rebecca Sosa. Thank you.
No, thank you, Madam Mayor. I have to say that I am really impressed and thankful to you on behalf of the Chair-elect Diaz and the Vice Chair-elect and all my colleagues that sit in the board, because bringing the experts together to guide us is the only way we're going to be able to succeed together. I take my hat off to the doctors and nurses and the first responders who are the ones who are out there facing the virus, and that is something that we will have time to do. But the concern is, Madam Mayor, the number of cases that we are beginning to see on a daily basis. And the question is, working together with cities and experts is the only way we're going to be able to do something. And I thank you for that and for bringing this to the table to work all together for the safety of our residents. There's no strong economy if without health. So we need to balance both. We need to continue with the economy, but we need to work very hard with the health care of our people. The questions are also, what regulations are under our jurisdiction? And when I say our jurisdiction, I say the county and the cities, that together we can do, that we can protect more with regulations, with all the social distance and the mask. But if we don't have the power to enforce it, are we going to be able to do it? And I know we have to base our decisions on the doctor's advice, but also we need to see what is allowed for us to do. So I hope you guide us with all of us together so we can discover not only what the doctors are telling us we can do, but what the state allows us to do. So thank you on behalf of all my colleagues for this opportunity, and to all of you. It's so wonderful to see so many experts in this call. Thank you very much.
Great. Thanks, Chairwoman. And now we'll hand it over to Dr. Peter Page, our new Chief Medical Officer.
Good afternoon, everyone. And I wanted to start by thanking Madam Mayor for her kind comments and really thanking her for the opportunity to join her team as the Chief Medical Officer of the county. I had the good fortune of meeting with her team late this morning by Zoom. And, you know, I'm really excited to join such a great group of people in this mission as we go forward. I also want to say, you know, I'm really excited about the opportunity to really help protect the health and well-being of our Miami-Dade residents. You know, I think it's a great opportunity for us to not only strengthen, but also, you know, make a more effective public health response for our county. I think the only way we're going to be able to do that is by really coming together, as has been mentioned previously already on this call. I think we have I know we have a lot of content experts in the county and in a lot of the facilities, a lot of whom are represented on the call today. We will be capitalizing on that expertise to help drive our projects forward. But really, we need to come together. And we need to take a little bit of a different response to help make it more effective and try to mitigate the risk of this virus going forward. As everyone has mentioned, you know, the numbers are increasing. It's rising concern for the county and for our cities. And it's time that we take a little bit more aggressive action to try to minimize the risk of this devastating virus going forward. I did want to take an opportunity to speak a little bit about the holidays. You know, obviously, Thanksgiving's 2 days away. Holidays are a classic time for gatherings, families, friends. We understand that. This is an unusual year. We have to embrace that. And we have to look at opportunities to try to minimize our risk of having holiday celebrations while still enjoying the company of family and friends. One great option, virtual celebrations. I think we've all gotten used to some of these virtual Zoom meetings, for example, and it is, you know, a great opportunity to stay safe and celebrate with family and friends, both near and far, for those who would at least consider that as an option. If there is going to be a gathering, if you are going to host a gathering, as Madam Mayor had mentioned previously, immediate household members, small numbers, try to gather outside. We're in South Florida. You know, this is really, you know, why we're in South Florida as far as weather, when the weather is so beautiful this time of year. So take advantage of that opportunity and decrease the risk that is inherent in inside gatherings. If on the other hand, you are going to host a gathering, it is going to be a larger group, family and friends. You know, there are some things we can do to minimize the risk or decrease the risk even in those types of settings. As we mentioned, outside versus inside. Masking, social distancing, you know, we have to keep that, you know, that as a priority wherever we are, whatever we're doing. Gatherings with families and friends are no exception. Obviously, eating or drinking is difficult with a mask, so that would be an exception, but otherwise mask wearing throughout the event. I think another thing to remember is that this virus is very transmissible. asymptomatic individuals can pass this virus from person to person. So just because people don't have symptoms doesn't mean that you're safe and not at risk of being exposed to the virus with them. Clean surfaces, disinfect surfaces. People, I think, have gotten a lot better at this, but just be cognizant, conscientious of it going forward, especially if you have a gathering at your home. And consider families and friends that are traveling from other households to have them bring their own food, containers, utensils, anything to help minimize the risk of spread of the virus during the gathering or the reception. The other area I would like to mention is really about travel. You know, we're seeing the airports getting busier and busier. Obviously, the risk is inherent in travel. We have to keep our guard up. And remember, it's not just while you're on a bus or on an airplane. It's on your way. It's after you get to your destination. Maintain your masking. Maintain your social distancing, hand hygiene, clean surfaces, you know, and really try to keep that at the forefront of your thinking as you're going through some of these higher risk situations. And the last thing I will say is that, you know, we're seeing a lot of positivity in the younger age group. Oftentimes this younger age group is less symptomatic or asymptomatic, and they may not be as cognizant of the risk of their positivity. But we have a lot of vulnerable people in our population, in our cities, communities, and counties. We have to be mindful and protective of our family, friends, and members of the community that we may not know that are at a higher risk. And to spread it to those obviously can cause devastating consequences. So thank you for the opportunity to speak to those areas. You know, I wish everyone a wonderful Thanksgiving, and I look forward to hearing from everyone else. Thank you.
Great. Thanks, Dr. Page. And now we'll hear from Mr. Migoya, President and CEO of Jackson Health.
Thank you, Rachel. First, let me thank Mayor Cava for her partnership with Jackson. We really appreciate our ability to share Dr. Page with you. You know that Jackson is your hospital. It's the hospital for every resident of Miami-Dade County. We're very, very proud to be able to do that. Through Dr. Page, we provide, obviously, not just Dr. Page, but all our top specialists that we have at Jackson, which include Dr. Albo, our Chief Infectious Disease, Dr. Ferreira from the University of Miami, Dr. Marty from FIU, have all been advising and will continue to do so. We've got still a long trip ahead of us. I will tell you that for the last 14 days, Mayor Cava mentioned that we've seen double the numbers of infection rates. We've only seen a growth in beds of 37%. The reason for the difference is what Peter just mentioned before about the fact that the high infection rate are the younger people, which may not be getting sick right away. However, they may be infecting other people, and we may see a higher rise of that number in the future. So we need to be concerned. Other parts of the state, other parts of the country are seeing 50 to 100% growth in hospitalized beds. So to some degree, we may have been able to benefit from the fact that we had that high peak in July, and maybe that's also softened it up. But we cannot wait until that happens. So I think it's important. Everything that Dr. Page mentioned as to the precautions are extremely important, especially as we go into the holidays, to make sure that we can maintain and reduce as much as we can the infection that is going on, so that those people at risk have less possibilities. Briefly, I know that Mayor Cava also talked about the vaccines. I would like to let you know, in confirming some of the information from HHS Secretary Azar today, he did mention that there will be 40 million doses being out in the United States under Pfizer, as soon as Pfizer's already applied for the emergency FDA approval. That's expected to happen sometime in the second or third week of December. When you say 40 million doses, remember Pfizer takes 2 doses per person, one immediately and the other one 21 days. So that brings it down to 20 million people. The estimates, according to him, because it will be distributed based on population, that the state of Florida will probably get about 2 million of those doses, or for 1 million people. That being the case, we could see as many as 100,000. I don't want to say that that's the number we're going to receive. I'm saying that that's what we could see. We really won't know until we get closer to those dates as to the actual number that we will see. The priorities are going to be based the way it's been given right now as to the governor and his staff, is that we will first provide it to our healthcare workers, first responders, and people at risk. It will be in that order based on the instructions from the state, which according to HHS, the state will be the ones that give us direction as to who to give those doses first. But that's just early on. We will see. We will hear more about that over the next 2 to 3 weeks as we get closer to the vaccine. And I will tell you, I will caution you in everything I just said on the fact that all that information has been changing by the day. So I would not say that this is exactly the way you're going to see it 3 weeks from now on. This just happens to be the latest information. So I'll stop there and I'll let Rachel go on with everybody else, and I guess we'll get to a point of Q&As.
Perfect. Thank you. So now I'll hand it over to our city mayors to give remarks, beginning with City of Pinecrest and Miami-Dade League of Counties, League of Cities, Vice President Joe Cordino to speak.
Thank you very much. Thanks, Mayor, for putting on this important press conference today. I'm proud to represent not only Pinecrest, but the Miami-Dade County League of Cities. Our municipalities have really been on the front lines helping struggling residents and businesses through this crisis. And we're glad that our new county mayor is standing alongside so many of our city leaders from across the community to present this unified strategy to tackle the pandemic. Again, we're also glad to welcome our new Chief Medical Officer, Dr. Peter Page, to work alongside our cities and businesses as we help ensure we're putting together the smartest policies we can to protect our people. As we head into the holidays with the cases rising, we believe it's critical that we come together as one community to make sure that all of our residents in all parts of the county understand the guidelines and the policies that will keep them safe. And I can assure you that the Miami-Dade County League of Cities will continue to work with all of our local governments and our new county mayor, Daniella Levine Cava, to help us keep moving forward and to keep our families safe during this crisis. Again, it's of critical importance to our cities that we all become more unified and tackle this with one voice. And this is a great step in doing that. And I thank you for the opportunity to be here.
Thanks so much. And Mayor Suarez, you're up next.
Thank you, Rachel. And thank you all. I hope you can hear me through the mask. But I want to thank you all for the opportunity. I want to thank Mayor Levine Cava for assembling this great group of people. I think it really demonstrates her ability to convene people from a variety of different sectors that are important in our city and our county. And I commend her for it. I commend her for getting everybody in the same room as we discuss how we're going to approach COVID, which is obviously the largest threat in our community right now. I was on earlier with the coronavirus task force nationally, and I can tell you that Dr. Burks and Dr. Redfield, the CDC director and the head of the coronavirus task force, are extremely concerned about the rapid rise of numbers, both in the new cases and in the hospitalizations, in the nursing homes. Obviously, they're very concerned about Thanksgiving. They're also concerned about the fact that they know that as local governments, we don't have all the tools in our toolbox that we could potentially be able to use to mitigate the spread of COVID-19. And so that's something that is an enormous concern for me as mayor of the city of Miami. I know that the county mayor shares that concern. I know that the other mayors, Mayor Gilbert, Mayor Cordino, and all the mayors share that concern as well. And so I'm going to continue to reach out to the governor, to impress upon him the need for us to have that kind of local control so that we can take whatever steps we feel are necessary to mitigate the spread, as we did very successfully in the summer. I am wearing a mask right now where I am in public, and I did feel that the mask in public rule, and can document that the mask in public rule led to a significant decrease in the spread of coronavirus, a 90% decrease in our community. And so, we socialized that with Dr. Redfield, who agrees from the CDC. He says there's ample evidence from a variety of different studies in different states throughout the United States that demonstrate why wearing masks in public works. And so, we have to continue to collaborate and try to speak in a unified voice as much as we can. And I'm committed to trying to do that with our county mayor. And she's been wonderful in terms of giving us in the city an opportunity to do the things that we need to do to try to contain the virus as well and be supportive. She's been extremely supportive, and I'm grateful for that. So I thank her. I'll just say very briefly in Spanish, en este convocatorio con los alcaldes, con la alcaldesa del condado, Daniella Levine Cava. Hoy estaba con el Task Force de Coronavirus Nacional y ellos enfatizaron la necesidad para nosotros poder controlar localmente los requisitos para poder controlar la propagación. Inclusive discutimos la efectividad de las máscaras en público y ellos tienen documentado estudios que demuestran qué efectivo es tener que usar la máscara en público, tanto como otras diferentes medidas que hemos tomado para reducir la propagación. Así que estoy muy orgulloso y agradecido por la alcaldesa Daniella Levine Cava por convocar esta reunión de no solamente líderes políticos, los líderes científicos y líderes de nuestra comunidad, presidentes de universidades, para nosotros tener una solución que podemos hacer de una forma coordinada y poder hablar con la misma voz. Thank you.
Great, thanks, Mayor. And next we'll hear from Miami Beach Mayor Dan Gelber.
Thank you. And I appreciate the opportunity to be here with my colleagues. If anybody wondered what kind of Mayor Cava was going to be in terms of bringing everybody together to work with a common purpose, there are over 150 people on this Zoom representing the many facets of this challenge. So just this alone should be a very good sign to the community that we aren't going to leave anything on the field. We are going to bring every part of our community together and really level onto this great challenge. You know, the fact that the impact of this virus is sort of lagging is something that we have to be aware of. We don't feel the sickness and hospitalizations for often weeks after those initial infections come in. Last week, we saw days of over 2,000 infections on a single day. So we have not yet even felt that impact in our community in terms of additional positive cases and hospitalizations. Yet we now have the time when traditionally we do all the kind of gathering we do as a family and as a community. So this is really the holidays approaching in the midst of this ongoing surge. Kids coming home for the holidays like mine have becomes a confluence of very potentially dangerous circumstances. So I would give you just this. Please wear the mask. My city, even though we can no longer impose the fine right now, we will resume giving out free masks and citations if for only the messaging that it is so important to keep that mask on. And during Thanksgiving and other get-togethers, please be protective of the elderly, family members, folks who might have vulnerable situations. Most infections are from people who are asymptomatic, according to our contact tracers. So they're not even showing infection when they infect you. And as Dr. Page pointed out, we are blessed with a beautiful climate. Consider going outdoors. I was so happy to hear the mayor talk about contact tracing. Right now, I looked at the last 2 weeks of data this morning, and only about 35% of those called are cooperating, of those infected are cooperating with the contact tracers. That means that the majority of folks who are reached out to never give their close contacts, never allow the contact tracers to see who else has been infected and who needs to be quarantined. It's anonymous when you get called. So please cooperate with the contact tracers so that we can cabin and control the spread. Look, despite this awful road we have been on, I am thankful, very thankful, that the virus will soon be in our rearview mirror. But now is definitely not the time to let up. We need to lean into these protective measures now more than ever. It's time to have a wonderful but very safe Thanksgiving. So have a great Thanksgiving, everybody.
Thanks, Mayor Gelber. And now we'll hear from City of Hialeah Mayor Carlos Hernandez.
Thank you so much. First of all, I want to say hi to everybody on the Zoom conference. Very happy to be here today and again see our new county mayor, Mayor Cava. Again, unite us, because that's been one of the biggest issues we had with the previous administration. There was no unity, nothing between the cities and the ex-administration. So that is great. And I'm not going to repeat a lot of things that my colleagues have already said that are important. I will say some things in Spanish. The only thing I do want to add is that it's great to be united here in Miami-Dade County. We know the need of our community more than anybody else. Hopefully, our state government, including our governor, will understand that we believe in science. We believe that science is the best way to keep our businesses open and keep us healthy. And maybe he'll start seeing it that way and allow us to do some of the things that are important for our community here in Dade County. Primero, me honra estar aquí con mis colegas y ver que la alcaldesa Cava ha unido al condado, algo que no había pasado en el pasado con la administración anterior. Así que gran noticia para todos, trabajar juntos contra este coronavirus y ojalá que el gobierno estatal, nuestro gobernador DeSantis, entienda que la ciencia es muy importante para mantener nuestros negocios abiertos, para mantenernos saludables y que entienda nuestras necesidades aquí y trabaje más unidos con nosotros usando la ciencia, que es muy importante. Así que thank you, it's an honor again. And Mayor, thank you once again for uniting us together and working together on this.
Great. Thanks, Mayor. And as Mayor Levine Cava mentioned, we have a number of business leaders on the call. And now we will hear, last but definitely not least, from Michael Finney, the President and CEO of the Beacon Council.
Thanks, Rachel. And Mayor Levine Cava, thank you for allowing us to have an opportunity to say a few words on behalf of the business community. Also, thank you for your 2 years of service as the County Commission's representative on the Beacon Council Board and for your continued commitment to serve as one of the co-chairs for the One Community, One Goal initiative. I also want to make sure that I properly thank all of our municipal and county officials who have just steadfastly worked to put in place the kind of guidance that you just recently heard from all the mayors and other representatives who have spoken. That guidance really made a difference as we worked with the business community to try and move through the reopening and to support as many of those businesses as possible with the various programs that were available. We know that Miami-Dade County is a small business community. If you look at the tax collector's records, there's nearly 90,000 small businesses in Miami-Dade County. They represent about 90% of the total businesses that we have here. So clearly we are a small business community, and the vast majority of those are tied to the tourism and hospitality industry. So it's really important that we find ways to help those businesses get back on their feet. And a big part of doing that is, in fact, our adherence as residents, citizens of this community to all the recommendations that are coming from our experts in the medical profession and in the scientific community. It's just critically important that we all as individuals follow the recommendations that's being made by our healthcare professionals. Likewise, for the business community, a big part of your ability to maintain operations and to reopen safely is highly dependent on your ability and your commitment to enforcing the various rules that are being established or guidelines that are being established by our elected officials in all the communities throughout Miami-Dade County. And so we just encourage all the businesses to enforce those guidelines to help ensure that you have the highest probability of ongoing success. I also want to just briefly mention that we have really worked to organize a lot of organizations in this community that's focused on helping small business. They include partners like Branches, Catalyst Miami, Career Source South Florida, the Greater Miami Chamber of Commerce, the Miami-Dade Chamber of Commerce, and of course my friends at the Greater Miami Convention and Visitors Bureau, and so many others. And we're all focused on trying to bring resources and support to small businesses that can help make a difference as you go about reopening. So look to us, look to this partnership to be available as a resource to help you, and obviously, Madam Mayor, to help you and your team move this community back to the state of economic prosperity that we've all come to know. And please, everyone, have a safe and enjoyable Thanksgiving.
Thank you so much. So that concludes all the folks speaking on the program. We have some time for questions now. So I'm going to go ahead and go through and unmute folks who put their hands up. Just a reminder to please put your hand up in the Zoom if you'd like to ask a question. And when I unmute you, if you can just go ahead and direct your question to, if you're asking it of someone in particular, to mention that in your question. So we'll start with Carlos Suarez from NBC6. If you can please unmute Carlos.
Hi, everyone. Thanks for the opportunity. I have just two quick questions. The first might be for Levine Cava and Dr. Page. Dr. Page, you said that a more aggressive approach needs to be done. Can you spell out that aggressive approach? What's different? What are you suggesting that's different that's been done before? And then my only other question is for Mayor Gelber. why was the city not issuing face masks violations, even if they were unable on the fine? So just those two questions. Thank you.
Thank you for the question. I would say when I say more aggressive, I think we need to be more consistent, and I think it needs to be, carried to a different level in the sense that we're heading into a holiday season where there's known gatherings. We know this is coming, and we know that our numbers are increasing, and so we have to be more vigilant. We have to be more thoughtful and conscientious about, it's very easy to have a gathering at your house and family and friends and kind of get lax as it relates to masking, social distancing, cleaning surfaces, being cognizant of others and being cognizant of large group gatherings. I think that we're at a higher risk time frame right now because of the holidays that are upcoming, but I still think that I think a lot of the members of the community have done a great job at adhering to a lot of these recommendations and guidelines. I think we can still get better. Essentially, be much more conscientious about the people we're with and the people that are at risk and the people that, we're potentially exposed to.
And I'll just add that we have the rules. We want everyone to be aware of the rules, and we want people to take the initiative to follow the rules. And we have the business community on to communicate that to their members as well. So businesses are fully aware. We have our police department for the county on the line, making sure that they're utilizing their efforts, first of all, to advise people. We're not in this to punish people. We're in this to make sure people do follow the rules for the safety of everyone. And our cities as well, to all speak with one voice so that there is no doubt about the rules and what needs to be followed.
So I'll answer the question about the masks. We were, I think, the first city in the country, literally minutes after the CDC changed their rule and their guidance to create a mask mandate. And since then, we've kept expanding it. And along with Mayor Suarez, we've been big on masks. When the governor issued his executive order some time ago, preventing local governments from actually putting the citation with a fine, we stopped. We had given out 1,000 citations up to that point, I think more than anyone. We, decided that it was hard at that point to give somebody a piece of paper without it actually having a fine attached to it. We decided, over the last week, as we've seen this come up, that we're going to have our police and code. We're going to offer free masks. And then if they don't take the mask, we're going to give them a citation. How effective this is, I don't know. But I know that with this surge that we're feeling right now, it's really important to message into the community how vital it is to wear the mask. So we hope this will be more effective. Other communities are doing it too. It's obviously not consistent. I think the governor doesn't want us to be doing this, but I don't think we have a choice at this point with the holidays coming and with so many people in a community like ours, all of our communities, the hospitality community. We need to let people know they've got to wear masks, and we intend to do it with every measure and every method we have available to us, including citations, even if we can't collect a fine right now.
Great. Thanks, Mayor. I think next we have a question from Christina Vasquez. If you can please unmute her.
Hi there. Can you hear me?
With so many people in a community
I'm
like
sorry.
ours,
I'm also monitoring on the other device. Stand by. Sorry. Trying to gather in real time. Okay. Sorry about that. I have one is a point of clarification, and then the other is a question. The point of clarification is just to be sure that it sounded like the COVID-19 testing sites will be open on Thanksgiving Day from 7:30 a.m. to 1 p.m. And then the question, and this could be for Dr. Page, maybe primarily for Dr. Page. And I've been at Miami International Airport for a couple of days now, most recently this morning. And, we're definitely hearing something you all have alluded to, which is this pandemic fatigue. But for instance, one person I interviewed just this morning, he literally says, I think I think everyone's taking this too seriously. So it's a little bit of pandemic fatigue tinged with apathy. So for when you hear that, and I'm hearing this consistently from community members, what's the number one takeaway? We've been telling them since March, right, to wear a mask and social distance and wash their hands. At this moment, at this time, what do you think is going to be the message that breaks through that?
Excuse me, Christina, I just want to ask our Chief Kaminsky to answer about the test sites, because it's the county test sites that will be open for those hours. Could you clarify, Chief, about the overall situation with the test sites, and we will be issuing some information as well.
Hi, good afternoon. All the county test sites, which is 9 of them, will be opened, as the mayor stated, from 7:30 to 1 o'clock. The state test sites will be closed. We also have the 8 Sprinter vans that we utilize throughout the county. They also will be in service operating from 7:30 to 1 as well.
Thank you. And then I guess Dr. Page, perhaps really hitting that community message and speaking to at least what I'm hearing from lots of folks in the community, most recently this morning, with this concept of everyone's taking this too seriously. I'm meeting with my family. I'm doing this Thanksgiving, and that's.
You know, I think you raise a great point. I think there is a certain amount of pandemic fatigue, and I fully understand it. And I think people have done an amazing job over the course of the summer, especially after the surge, to help us recover to a much better place. The problem is that when you see the devastating impact that this virus has on a lot of our communities, you know, it really strikes a nerve that, you know, really makes us more intense in trying to protect our communities and our residents and our families and our friends. I think that some people may not appreciate the vulnerability that certain members of the population have to this illness. And I think that, combined with the pandemic fatigue, you know, probably plays a role in some of that kind of thought process that you're appreciating at the airport. From my perspective, this is a very critical time for us. We're seeing positivity on the vaccine front, so we do see some light, you know, at the end of this tunnel. But we've got a little path to get through before we get to that light. And we have to be even more vigilant as we head into the holiday season, you know, and really up our game to a certain perspective. We know what this virus can do, and we know if we let down our guard, it's gonna attack and attack and attack and cause more and more devastation. And so we really need to, you know, really motivate people, incite people, excite people to take it very, very seriously for the next several months and get us through this very challenging time. And we understand people are going to gather, and we understand people are going to want to get together, but we can do it. We have to do it in a little bit of a different way this year in an effort to protect all of our citizens.
Great. So I think we have a question from Ana Cuervo from Telemundo. Ana?
Buenas tardes. Tengo 2 preguntas. Una es para la alcaldesa del condado, para Daniella Levine Cava. Dado que está intentando unir a todos los alcaldes, a todas las ciudades, ¿está considerando hacer lo que está haciendo el alcalde de Miami Beach y imponer multas para obligar a las personas a utilizar las mascarillas en público, dado que se acerca, ya estamos en el Día de Acción de Gracias, se acerca la Navidad, del Año Nuevo, y sabemos que aumentan los casos, suelen aumentar cada vez que tenemos un feriado, como tuvimos el 4 de julio, Halloween? ¿Es algo que va a considerar a lo que es a lo largo de todo el condado Miami-Dade? Y también después tengo una pregunta también para Carlos Migoya. Si después regresas a mí, Rachel, you'll come back to me for a question for Mr. Migoya.
Okay, bueno, gracias, Ana. Déjame decir que lo que están haciendo en la playa, también estamos haciendo en el condado. Lo primario es siempre dar información, educación. Es lo más importante de todo. No queremos dar multas y no podemos colectar las multas en esta época tampoco por las reglas del Estado. Entonces, lo primario, como estamos diciendo, es educar, un mensaje muy claro, muy unificado, y después, si es necesario, hacer citaciones para colectar las multas adelante.
And you have a quick question for Mr. Magoya?
Un caso drástico en casos, vimos un aumento muy grande en los ingresos y en la cantidad de personas en los centros de cuidados intensivos. Esto no parece ser el caso ahora. ¿Es porque el virus está dando con menos gravedad o es porque los pacientes son más jóvenes o que ha mejorado el tratamiento? ¿Cómo se explica eso? Porque parece que los hospitales no están demasiado llenos. ¿Eso es correcto?
Como había mencionado la alcaldesa anteriormente, el número de infecciones ha duplicado en el condado en los últimos 14 días, pero las camas de pacientes que están necesitados de hospitalizar solamente han subido un 37%, que es una cifra bastante grande, pero los números todavía son, en este momento tenemos camas en el condado de personas enfermas de 630 camas. El peor de los casos que nosotros tuvimos fue el 20 de julio, que fueron 2.300. O sea que el sistema todavía tiene suficiente habilidad de poder, y que aunque no queramos, ¿no? Pero tenemos suficiente posibilidad de tener pacientes adicionales. Eso quiere decir que en este momento la infección principalmente son de personas, el porcentaje más grande de personas más jóvenes, típicamente de promedio de edad de 18 a 34 años de edad. Estas son las personas que están en la calle. Dos cosas. Primero, del momento que se enferman, el momento que se agravan en una situación que haga falta hospital, típicamente son 1 o 2 semanas. O sea, no sabemos exactamente cuántas de esos pacientes van a tener necesidad de hospitales. Y la otra cosa, aunque no sean ellos que tengan que dar falta cama de hospitalizar, posiblemente los familiares mayores que tengan otras enfermedades pueden ser infectados por esa misma persona, y por eso tenemos que estar con mucha precaución en estos momentos de reducir la infección lo más posible por todos los residentes de Miami, y no pensando que soy joven y no importa, no, tú puedes infectar a tu padre o a tu abuela o a tu tía, y esas personas pueden morir, porque todavía, aunque personas dicen que no hay tantas cosas pasando, desgraciadamente al diario mueren personas con COVID. Esto es un virus que mata y es muy peligroso.
Muchas gracias, mi amigo. Gracias.
Great. Next up, we'll go to Doug from the Herald.
Hi, thank you so much. Could I ask 2 questions? One of Mayor Levine Cava. You didn't mention the curfew. Do you feel the curfew is helping slow the spread of COVID? And are you asking Mayor Suarez to lobby to have Miami begin enforcing it?
Well, thanks, Doug. Yes, I think the curfew is important. I did sign to extend those orders pertaining to the curfew. I also had a chance to discuss this with Dr. Page, as well with Drs. Birx and Fauci. There is an understanding that it is not number one. Number one is masking, then the distancing and so on, but it is a part of our toolbox. It is a tool that we can utilize, since we cannot utilize all the possible tools, and it is one that seems to really help in the later hours when social distancing and masking are less likely to occur. And I've also spoken to Mr. Magoya, who is in agreement that this is an important measure for us to continue. And then as far as the city of Miami, yes, I'm hopeful the city of Miami will work with us, and we're having conversations on that matter.
Thank you. And then could I ask Mayor Suarez, I believe he's still on the call. Mayor Suarez, is Governor DeSantis returning your calls? What are you saying when you're hoping to reach out to the governor? Is he not getting back to you?
No, so we had a call scheduled last week. I called at the appointed hour and then called a second time, was not able to get through to him. I heard from his people that he did not see the missed call. So there was for some reason, some communication glitch there. And I've just, we haven't been able to hook up since then. Yesterday I was on with the, President-elect, Vice President-elect. Today I'm on with you all, and just haven't had an opportunity to connect with him. But, and I was on today also with Dr. Fauci, with Dr. Birx and Dr. Redfield. So it's been a busy time. I'm hoping to hook up with him today or tomorrow.
And did you want to follow up on the curfew comments from the mayor?
No, we've talked about this before. Our commission passed a resolution that does not allow us to enforce the curfew. We don't have any ability to change that unless there's a commission action. I thought that it was possible that it might come up at the last commission meeting. It didn't come up. The next commission meeting that we have is December 10th. It may come up then. I agree with the mayor that, to me, the mask in public rule is far more effective. And I think all the conversations that we've had with Dr. Fauci at the last call, this call with Dr. Birx and Dr. Redfield, they continue to emphasize the importance of wearing a mask in public. And that, for me, along with, we did it with all the mayors at the time, was really, in my opinion, what led to the precipitous decline. We have the curfew in place right now in all 33 cities plus Miami-Dade County unincorporated areas, and we're still seeing the numbers increase. So when we saw the decline was when we had an effective mask in public rule that we could find. We have a curfew now, and we're seeing an increase. So it's unfortunate, but it's something that we'll continue to discuss internally and see where we go from there.
Thank you.
Great. So we have a few more hands up. We're going to stay on a little past 3 for everyone who can continue on with us to try to get through all the questions, but understand if some folks do have to drop off. So next we'll hand it to Raine Anciani.
Sí, buenas tardes, gracias. Quisiera preguntarle a la alcaldesa Levine Cava que nos ayude un poco a recapitular cuáles son esas regulaciones que siguen en pie en el condado Miami-Dade, para estar claros, con respecto a esto que comentó del uso de la mascarilla, el toque de queda, cómo queda, ¿no? Y la otra pregunta, que también puede ser para otros de los alcaldes que están presentes, tiene que ver con si tienen previsto unirse y hacer algún recurso, algún pedimento oficial al gobernador Ron DeSantis para poder poner en práctica localmente las restricciones. Veo que hay consenso en esa materia, que todos están preocupados porque están limitados. ¿Van a hacer algo más a nivel del condado para poder exigir este derecho de imponer medidas a nivel local? Gracias.
Gracias para estas preguntas. Puedo decir que yo firmé todos los órdenes que tuvimos antes con alcalde Jiménez, y por el momento eso incluye máscaras, toque de queda, distancia social dentro de los negocios y restaurantes, si ellos pueden hacerlo, si no es automáticamente, pero si ellos pueden acomodar, si ellos tienen que acomodar el espacio, y varios otros detalles. En esa cuestión del gobernador, sí quiero hablar con él, claro, y también quiero más que podemos hacer más aquí localmente con el conocimiento que tenemos aquí localmente. Estamos en el momento mirando, monitoreando muy fuerte, muy concentrado lo que está pasando con los casos, y por el momento ha subido, pero no al nivel como antes, no al tan rápido, y si seguimos usando las precauciones, nosotros pensamos que podemos seguir adelante como somos.
Great. We have a question from Ben.
Yeah, thanks for taking my question. This is for the mayor. Mayor, what role, if any, does the county play in vaccine distribution? And this question is not limited to the Pfizer vaccine, but really any vaccines we might get through the state Division of Emergency Management.
Thank you for the question, Ben. We're really grateful that Jackson is one of the first places to receive the vaccine, and we understand it. It's been stated that we're going to focus on those who are most at risk, our caregivers. That will be, I'm sure, a couple of months, and then the more vulnerable, and then to the general population. And we stand ready, willing, and able to assist. I know the state is looking at a distribution system, and I'll defer for any more details to Carlos Megoya, or to anyone from our team who's been in touch with the distribution. We have Dr. Vialta as well from the health department on the line if she has something she would like to contribute.
In conversation, thank you for that, Mayor Cava. In conversations we had with the governor last Thursday and today with HHS secretary, the distribution of Pfizer will go directly from Pfizer to those hospitals designated. So in the case of the state of Florida, are those 5 hospitals, and it will be based on proportionate share of population within the regions of those hospitals. In our case, the population is really Dade County, because Memorial has Broward County and Palm Beach. As far as the next outside of Pfizer, the next ones, we were told that those will go directly to each individual hospitals as they have needs throughout the different environments. So as I was told, that the state or the federal government will not be involved in the distribution of that. It will be done as demanded. The one thing I didn't say is, in addition to the 5 hospitals obtaining vaccines for those that we talked about, it's also been, we were told that Walgreens and CVS will be given some of the Pfizer meds to provide vaccine for nursing homes and ALFs. Not for the public, but for nursing homes and ALFs. So besides the people that I mentioned, healthcare, police and fire, as well as people at risk from the hospitals, CVS and Walgreens will be in charge of making sure that every patient in a nursing home and ALF will be vaccinated if there's enough vaccines for all of them.
Just a quick follow-up. I'm sorry. Is there any, this might be for you, Carlos, are there any areas of the county right now, Miami-Dade, that you're particularly concerned with as far as areas that are hot with virus at the moment?
Ben, the areas continue to be the same areas. Frankly, right now it's not so much a demographic as it is an age range. So we see all parts of the area, especially the more working class zip codes being the ones that have the higher rate of infection, but it's typically the younger people that are actually getting infected.
Great. And we have time for just one more question, I think, and I appreciate everybody staying on a bit after. So Laura Rodriguez.
Hi there, Laura with NBC6. So I've received many phone calls throughout the last 2 weeks from business owners in the community. There's a lot of anxiety just over potential closures. I know right now the governor has sort of put limitations on local mayors. Maybe this question is for Mayor Levine Cava. If the governor allows local governments to make these decisions, will you be adding further restrictions to the hospitality industry, businesses in general? Are we going to go back to any sort of partial shutdown? I'm asking more of a direct question because I do feel that, many business owners in particular feel that there's, a lot of runaround just because the governor, isn't allowing local governments to make these decisions. But if, in fact, that is lifted, if the governor says, okay, we can go back to a time where local governments are making these decisions, business owners are saying they don't want to be caught off guard. They've, if they go through another round of shutdowns, they will not make it. So what is your message to these business owners, and will you do another shutdown or partial shutdown?
I've been very clear. We're focusing on precautions. We're focusing on cooperation. We're focusing on a unified, simple message. We have proven that we can take charge of our community and fix this problem by taking the right steps. For my purpose, my cause, the reason I've appointed a chief medical officer, the reason why we have broad representation on this call is it's something we must do together. We cannot have people the exception to the rule. We must all proceed with the simple steps, and we can get control of this infection, the spread. When I spoke to Drs. Fauci and Birx, they praised Miami-Dade County for getting a handle on the spread through the efforts we'd taken. So we have proven we can do it, speaking with one voice, making sure there is no doubt about what is expected. That is how we will get through this together.
Thanks. And Mayor, we actually have one more quick question from a reporter who was having trouble with the Zoom hands up. So Rosa Flores from CNN had a quick question.
Hi, thank you so much. Mayor, congratulations, first of all. And then I wanted to ask you, has the governor congratulated you? Has he called you? And then, because I know everybody's pressed with time, I'm wondering if anybody, any of the city mayors or leaders within the Zoom call, if they have heard as to why the governor has not had press conferences in 3 weeks. Thank you.
Well, I am looking forward to speaking with the governor, and I welcome his call. And I had the pleasure to speak with his local South Dade representative, as well as with Jared Moskowitz for emergency management. And we stand at the ready to work with the state. And I've spoken to many of our elected officials, and we are prepared to, again, have one message work together to get this done, to protect our businesses, our livelihoods, as well as our lives.
Great. Thanks so much again to everybody for joining us on the call today. Thanks to all the county leaders and to the city mayors and business leaders and to the members of the media. We now have Lionel, who will provide our Haitian Creole translation. So thanks so much, Lionel.
Thank you very much. Ici, département de communication, comté Miami-Dade, nous parlons pour version créole, déclaration, maire Daniella Levine Cava sort fait dans l'anglais avec espagnol. Bonsoir tout le monde. Merci d'être nous avec moi aujourd'hui à l'appel là, spécialement avec membre conseil commissionnaire, magistrat Vilio, nouveau chef officier médical noir, Dr. Peter Page, président Carlos Migoya, de Jackson Health System, et tout leader business. Merci d'être nous ensemble pour aider, communiquer à clé, à résidents nous, importance pour tout le monde empêcher la propagation du coronavirus là, particulièrement pendant la période fête qui a approché. Après, moi, été prêté serment, semaine qui s'est passée, première action, moi, comme magistrat, officiellement, c'est pour me nommer Dr. Page comme premier chef officier médical Miami-Dade. Il a un pile d'expérience dans la médecine d'urgence, dans le service d'urgence, avec gestion d'urgence, tant qu'on a aidé Jackson sortir dans la situation de crise de la santé. Avec Dr. Page, dans la position officielle, ça, quand Miami-Dade avec Jackson, par le travail main dans la main pour être capable de résidents en sécurité. Priorité numéro 1, moi, comme magistrat, c'est pour protéger la vie avec bien-être résidents. Mon engagement pour être capable toujours porter la bannière devant la communauté face à risque et à la réalité pandémie. Quand COVID-19 a augmenté dans le Miami-Dade, ça menaçait bien-être avec santé communauté noire. Augmentation CAIO veut dire tout, il y a un gros malheur pendier sur l'économie noire et après travail que nous finissons faire pour nous capables de mettre le virus là sous contrôle l'année ça. C'est pour ça, il est si important pour tout résident nous d'être vigilant et puis continuer à suivre précautions santé publique pendant la fête qui a approché. Jouer une façon pour nous jouer fête là sans danger, c'est clé bataille nous contre le coronavirus là pour empêcher tête nous, parents nous, voisins nous, premier secouristes avec travailleurs santé nous pour nous capables tout le monde ça protéger contre propagation virus là et combattre propagation en tout. C'est seule façon pour nous protéger business nous pour nous faire économie en rester jam. Jouer une façon pour nous jouer sans danger période fête là, ça c'est clair pour moment ça. Tant pis songez. Si vous avez maladie même s'il n'est pas grave, vous pouvez toujours transmettre les bails l'autre monde que ou remet il capable monde qui plus vulnérable quand vos parents, grands-parents, ma tante, tonton, frère, sœur et la trier. Il y a quelques directives importantes que nous devons toujours songer pour protéger tête nous avec l'autre monde pendant la période fête là. Puis bonne façon pour baisser la propagation du virus là, c'est limiter rassemblement nous seulement avec monde qui a vivre dans le même cas avec nous et puis célébrer dehors si c'est possible. Si on va organiser ou bien si on peut aller dans un rassemblement, il y a quelques étapes que vous devez kembe pour kembe monde qui remet en sécurité. Rassembler dehors parce que nous avons plus de chance que nous sommes capables de vivre dans la communauté quand nous sommes capables de rassembler dehors. Continuez à mettre masque, leur pas manger, leur pas boire, kembe distance sociale par rapport avec monde qui a pas vivre dans le même cas avec vous. Songez bien. Monde qui pas de symptômes capable toujours propager COVID-19. Nettoyer et puis désinfecter toute surface que monde touche souvent. Considérez demander inviter pour porter propre manger, boisson avec ustensiles. En pile d'autres ressources disponibles sur le site internet Miami-Dade là. Vous allez dans miamidade.gov/coronavirus. Et ces informations sont disponibles sur toutes chaînes médias sociaux. Moi, vraiment crois que il y a espoir dans l'horizon. Comme une communauté, comme un pays, nous va capable finalement mettre dos virus ça à terre. Pour continuer à avancer, nous pas capable de battre bas. Nous devons travailler ensemble pour empêcher le coronavirus là gagner. Et puis, nous devons prendre action là nous avec propre famille. Enfin, moun nan kote Miami-Dade gen bon cœur et puis yo résilient. Qualité ça avec tout engagement nous pour nous protéger une l'autre pour faire nous passer moment difficile ça de nous bientôt. Merci en pile. C'est pour bon Dieu bénir famille nous et puis nous souhaitons nous toutes joyeuse fête Thanksgiving. Merci.
Great. Thank you so much, everybody.